Hey, what's up? I'm Dr. Prasoon here. Ketogenic diet or keto diet. There is a huge hype around it. So, what is ketogenic diet? What are its uses? Is it good or bad for you? How does keto diet work? And do I recommend a keto diet to my patients? That's coming up in this video. This is DoFoodie, the best online doctor consultation platform in India. So, let's get started with this video. If you haven't subscribed to our channel yet, please do it right now. And when you do that, please click on the bell icon so that you don't miss out on any of our future videos. Before we dive into the details of ketogenic diet, you should know about the three major types of nutrients in our diet. And these are carbohydrates, proteins, and fats. Any food that we eat, it constitutes of roughly about 50% of carbohydrates or carbs, 30% of fats, and 20% of proteins. So that is majority of carbohydrates, adequate amount of proteins, and moderate amounts of fats. We derive our energy mainly from the carbohydrates by breaking down it into smaller molecules called glucose. Rice, wheat, flour, vegetables, fruits, anything that you take, its main component will be carbohydrates. Particularly if it is sweety and sugary, it will contain more carbs than proteins and fats. So, what is a ketogenic diet? A ketogenic diet differs from a normal diet in the fact that the main component is fats. 75% of a ketogenic diet is comprised of fats, 20% proteins, and only 5% comes from carbohydrates or carbs. So, how does that work? When fats comprise the main component in your diet, fats are broken down into smaller molecules which are called as ketone bodies or ketones, and this process is called ketosis. When a person switches over from a normal diet to a keto diet, it actually takes a few days for the process of ketosis to begin. Ketones are also capable of releasing energy, and because of the fact that we are not getting sufficient glucose from outside, in order to maintain the huge energy demands, the fat deposits in our body is made use of, and these fat deposits are broken down into ketone bodies. And this is in addition to the fat-rich diet or the keto diet that we are taking. So does keto diet reduce your body weight? Of course it does. And there are two mechanisms by which ketogenic diet reduces your body weight. The first mechanism is that in order to gain the sufficient amount of energy, fat deposits in our body is made use of, and they are broken down into ketone bodies to release energy. And the second mechanism is that when we eat a fat-rich diet, say for example, more of fats, more of oil, butter, meat, we attain an early satiety. We feel less hungry and we feel as if our stomach is full earlier than before. Now, because of these two reasons, over a period of time, say a couple of weeks, our body weight tends to reduce. When a person switches over to a keto diet, the initial weight loss is more contributed by the loss of water from the body rather than the loss of fat. So that's how a ketogenic diet reduces your body weight. Now, what are the other uses of ketogenic diet? Ketogenic diet has been used by doctors, and it is even prescribed by doctors for children who are suffering from refractory epilepsy or seizure disorders. Some other uses of ketogenic diet are that it can be used to treat fatty liver disease, and it can also be used to treat certain cancers. But these two conditions requires more research and more evidence, and since we do not have these kind of information right now, it is safer to assume that ketogenic diet can only be used for weight loss and to treat epilepsy in children as of now. What are the drawbacks of a ketogenic diet? The huge hype surrounding ketogenic diet is because of the fact that it helps in reducing your body weight very rapidly. It is also true that you cannot sustain a ketogenic diet for a long period of time. It is very difficult to find the right kind of food which meets the keto conditions. You will have to stay away from carbs, soft drinks, sweetened beverages, and even fruits. Switching over to a keto diet is a drastic change, and it requires a lot of time And some patients might also experience a condition which is popularly known as the ketosis flu. They might experience EC fatigability, nausea, vomiting, gastrointestinal disturbances, fogginess, and tiredness. Persons who are working out regularly will experience that their stamina has decreased when they switched over to a keto diet. And when your body weight decreases rapidly, you can expect other side effects such as gallbladder stones, muscle wasting, nutritional deficiencies, kidney issues, and bone diseases. And finally, do I recommend keto diet to my patients? The answer is no. Long-term effects of ketone diet has yet to be recorded, and sufficient studies and evidences are not available right now, and that's one of the main reasons why I do not recommend keto diet to my patients. So have you tried keto diet to reduce your body weight? What were your experiences? Please share your experience of adopting a keto diet in the comment section below. If you like this video, please consider sharing it with your friends and family, and please hit on the subscribe button. If you have any more doubts, you can ask online doctors using the DoFoodie app through chat, audio call and video call, anytime, anywhere. So I'll see you in the next one. It's me, Dr. Prasoon. Take care, stay healthy, and thank you so much for watching.